I was looking after this patient for, they had come forward for shockwave therapy for a very large renal stone. And he was only in his early 40s, but in spite of that, he, within the last 5 years, had 3 cardiac stents placed. And his, when I was talking to him about that, he said that his father had had a triple bypass before the age of 50. When he was describing this to me and what happened, he was clearly very angry and frustrated and upset still about what had led him down this path. And he described going to see his GP and asking for an ECG because he'd been having some chest pain, and given his family history. And he was declined, he said he was declined at ECG on the basis of, it wasn't necessary. And 2 weeks later, he had his first heart attack. Now for him, bias wasn't part of his rhetoric, racism was. And that's part of my driver in the research that I'm doing. And my point for mentioning that is not to be divisive. I really gel with a lot of the sentiments that John talked about earlier, but to recognise that the language we use does make a difference. We do need to be accountable, and to recognise that the people who are on the receiving end of our treatment decisions and behaviours will be affected by that, and they will have been through their own journey, which will colour that perception.